as you described, the tirzepatide and all those Monjaro, as people know by the name.
Yeah.
Sometimes they come up with side effects, and they're really scared of taking.
My patients from India, they don't want to take this medication because their mom or dad, they are on TikTok and they tell them not to take it. Or they hear that it causes stomach paralysis,
Right.
blindness, they're bad. Look, every medication has benefits and risks.
True.
So you have always to balance the risks and benefits. If
True.
your risks is more than the benefit, I wouldn't take it. If the benefits more than the risks, you can take it.
How important is muscle building in metabolic care or health?
I'll tell you the myth.
Okay.
The myth, don't take this medication because it makes you lose muscle.
Okay.
These medication work 70% reduce your fat and maybe 30% on the muscle, but you can keep the muscle by get enough protein. So you have to calculate based on your weight how much protein intake, and you have to do strength exercise.
So warm greetings all the viewers. Today we have with us Dr. Ahmed Al Sharefi from UK. He is a very well-known endocrinologist practicing in UK. Thank you so much, sir, for coming up on the WhatsApp.
Thank you very much. My pleasure to be here.
Sir, some of the viewers have questions.
Yes.
If their sugar workups are normal, but still they are feeling tiredness all the day, and they're craving sugars like anything all the time. So is it a worrisome question? I mean, do they have something wrong going behind the scene, or?
Yes. Okay. So I have seen many patients.
Okay.
That's exactly what they say. They say, doctor, I feel tired, fatigue. I crave sugar. I feel sleepy after meals. Is there something wrong with me? And the blood sugar is fine. There is something called metabolic syndrome or pre-diabetes. It could develop maybe years before diabetes starts, when there is high level of insulin. When this happens, sometimes you get these symptoms. But that doesn't mean you have something wrong, but it's just an alarming sign that you have to do something about yourself. So forget the blood test. There are other things. If you have obesity, you are at high risk anyway. So if you have the waist circumference is raised, everybody is, or your BMI is high, or sometimes subtle signs such as darkening of the skin in the neck or behind the arm, that's a sign of insulin resistance. Sometimes some blood work could show like fasting sugar, fasting insulin, and sometimes the liver function test. So these are very important. And other thing is the fatty liver. Sometimes you go do an ultrasound, you find fatty liver. It's a sign of obesity, of metabolic syndrome. So yes, you could have very vague symptoms, normal blood sugar, but that's not the whole story. We have to look at the bigger picture and fight obesity, because obesity is the lead for insulin resistance and for type 2 diabetes.
Right.
So do you have family history of diabetes?
They usually don't.
Everybody, like, it's very common to have a parent or a brother or sister with diabetes, and that's increase your risk of having type 2 diabetes. So my advice to everybody, if you are from a certain population when there is an increased risk of diabetes, you have to check your blood sugar, the A1C, once a year above the age of 35.
Right.
Don't wait till you are 50. Check it once a year, because you can detect early problems and can do some changes.
Right.
Okay.
What changes they can do in the diet, lifestyle? What kind of exercise is recommended by you?
Okay. Let me get this right. Some patients come to me, they're very lean, they're very healthy, and they have these signs, and they have insulin resistance. Okay. So bear in mind, there is some genetic component. So I don't want you to blame yourself because you are on the weight is high, or you are not exercising, or you're not going to the gym. Sometimes it's in the genes.
Okay.
If you do some lifestyle changes, either you prevent things from happening or delay things. For example, let's say in your family history, you have brothers or sisters or parents, they have diabetes at early stages. You may have diabetes at the age of 40. You're programmed to have that. But if you have adopted a very good lifestyle, you can push that to 50 or 60. So you buy extra years of life.
Right.
Number one tip, eat healthy. Like reduce carbohydrates. You can go on whatever diet you like, but reduce the carbohydrates. Number two, sleep well. Because sleeping less than 8 hours, for example, adult could do problems, and sleeping well is very crucial. Exercise, gentle walking, recommendation around 30 minutes 3 times a week should be great. Try to do brisk walking. Fight obesity, that's it. Don't be obese, right? So do some changes to your lifestyle, sleep early, eat healthy, move, but bear in mind, sometimes whatever you do is in your genes. So do your best to prevent this from happening. Now we have a lot of medications to help prevent diabetes. In India, I was so happy to find the new GLP-1s in the market. Now
Right.
we have the tirzepatide, you have semaglutide. They're amazing medication. The problem I have is patients who are looking at social media on TikTok and they're scared to take them.
True.
Our role is to raise awareness that these medications are safe, they are approved, and if you have obesity, you are very lucky to live in this time because you can have medication to treat that.
Right.
My advice is like obesity is a disease. It's not a lifestyle.
Mm.
You could improve your life because obesity gives you 200 diseases, 14 types of cancers. So it's very important to adopt any measures to prevent obesity and prevent their long-term complications. Okay.
So that's a single sentence that you have to fight the obesity. Reason being anything, either your genetics or whatever as you'd explain.
Whatever. I mean, you can do lifestyle changes, but that doesn't drop your weight that much.
True.
And you forget to come back again. You have medication, you can have surgeries. My advice is if you have strong family history of diabetes, if you have strong family history of high cholesterol, if you have slightly, chubby tummy, you need to work on that.
Right.
I don't want you to be perfect, but I just want you to live healthier.
Right.
If you lose weight, you can buy extra years of your life,
Okay.
and that should be the focus.
That's a straight way of calculating the healthy life years.
Yeah,
Right.
excellent. I mean, most of patients, they are scared to take this action, and the problem is we have shaming. Like you will say, some people make you feel bad about yourself.
Right.
You're not exercising, you're not dieting, your uncle did this and he managed to just shut your mouth, it will
True.
be fine. That's not right, because they don't understand that obesity is the disease. Your brain trying to put you back to your own weight.
Okay.
So we have tools. Get yourself checked. If you have symptoms of insulin resistance, get it checked, adopt a healthy lifestyle. Even if in your genes you can have diabetes like age of 45, by doing great work, by good amount of food, sleep, exercise, you just push it and you buy extra years of your life. That's the main message.
With all these efforts, we usually recommend patients to get support from new drugs, as you described, the tirzepatide and all those Monjaro, as people know by the name.
Yeah.
Sometimes they come up with side effects, and they're really scared of taking, because since it's a new medicine launched in the market.
Yeah.
So they usually try the alternative ways of losing weight. And how would you convince the patients to get the support from these pharmaceutical molecules?
I'm happy to be in India, right?
Okay.
My patients from India, they don't want to take this medication because their mom or dad, they are on TikTok and they tell them not to take it. Or they hear that it causes stomach paralysis,
Right.
blindness, they're bad. Look, every medication has benefits and risks.
True.
So you have always to balance the risks and benefits. If your risks is more than the benefit, I wouldn't take it. If the benefits more than the risks, you can take it. Now, every medication has side effects. The paracetamol has side effect. If you take too much, it can cause liver problem.
True.
This medication is FDA approved. They're safe. There are some side effects. I agree. There is some nausea and sickness. There is increased risk of pancreatitis, very extreme rare. The increased risk of gallstone disease. But if you live with obesity, you're already like, a silent killer. You have something worse. If you leave yourself, you'll have diabetes. That's it. But side effects of this medication are minimum if you take it under supervision.
Okay.
Don't just go to the pharmacy and buy it.
True.
You have to be assessed. We have to take into account your problems. Make sure there is no contraindication to take this medication, and you take it the lowest dose under close supervision. They are safe tools, but it should be done with lifestyle changes. It should be done with changing your habit. Otherwise, you lose the weight and you regain it back. Okay?
True.
So I would say, don't believe the social media, what they talk. Science said it's a good medication, it helps. Not for everybody. Not everybody tolerate the side effects. You have always to balance it and discuss with your doctor. I wouldn't do it myself. Do it under the doctor's supervision. And you lose weight, you live longer and healthier.
Okay. And also, we know that how important is muscle building in metabolic care or health?
I'll tell you the myth.
Okay.
The myth: don't take this medication because it makes you lose muscle.
Okay.
Right. That's what the bodybuilders, life coaches put on social media to scare people.
Right.
Now, you will lose muscle if you lose weight quickly. Full stop. If you do excessive exercise, you will lose muscle. If you go to do a bariatric surgery or a sleeve gastrectomy, after surgery, they give you protein shakes and they say, please take it, because you will lose muscle. So it's not the medication that make you lose muscle, it's how quick you lose the weight. If you lose the weight gradually, you'll be fine. You will keep the muscles. These medication work 70% reduce your fat and maybe 30% on the muscle, but you can keep the muscle by get enough protein. So you have to calculate based on your weight how much protein intake, and you have to do strength exercise. If you do protein strength exercise, you will preserve your muscle. The medication doesn't damage your muscle. It's your rapid unsupervised weight loss that will damage your muscle. So don't let this scare you. If you want to take it, or anybody want to take it, that's why I said under supervision, the doctor should explore how much protein you should take, and you should introduce lifestyle, because anything without lifestyle changes, we're not winning. You will not get the best after this.
Right. That's a beautiful explanation. So,
okay.
Last question. Some patients think they're like lean patients. For the lean patients, they're exercising regularly. They are so focused and well-controlled diet. Lifestyle is very good. They're even taking enough sleep. No stress in life. Do they also get diabetes? I mean,
yeah. That's why I said I have many patients who come very sad. They say, oh, I'm doing everything I can. I go to the gym, I eat healthy, I calculate. Despite that, I'm surprised my A1C is raised. As I said, it's not always lifestyle. We should remove this stigma from people, that because it's genetics. That's why I say, who's in your family has diabetes? You find a parent or a brother. It's in the genes. It's most of the time genetically inherited. It's not like if you have somebody, you will have it, but you are at higher risk of having this.
Right.
That's why you see type 2 diabetes more after the age of 35, 40, because your lifestyle goes down. So I think if you are meant to have diabetes, it will come. If you have a good lifestyle, you will just delay it as much as you can. But that doesn't mean it's always related to lifestyle,
right.
Because science say it's sometimes inherited in a polygenic way, so many genes interacting, environmental changes. Sometimes we can't stop diabetes, but we could prevent it or at least postpone it years and years.
Right.
If you have high weight, control your weight. That's the best advice. If you're eating rubbish, you should eat healthy.
Right.
If you're doing everything and you get diabetes, get on treatment then.
Right.
Okay.
Thank you so much, sir.
My
for
pleasure.
today's. It was very beautiful session today. Thank you so much
Thank
again.
you. My pleasure.
Thank you
Thank
so
you.
much.